Welcome to Ali Fitness Podcast, a weekly production all about bringing health into fitness. As a long life triathlete, Dr. Mike Heim has completed over 70 triathlons over the course of his career. Over the years of training and racing, he's gained extensive experience in sports nutrition and endurance training, as well as knowledge in sports injury care and prevention. He has a special interest in training in regenerative injection techniques, such as platelet-rich plasma and prolotherapy treatments. He completed his undergraduate degree in nutrition and exercise science and was the director of Health Center America and a faculty member for the American College of Sports Medicine. Now, if I go into all his other credentials, we'll be here for the rest of the afternoon. So let's skip over that and just say that he's very well qualified in, I believe, osteopathic manipulation, as well as all different types of sort of weight loss therapies, and very, very experienced. And I believe he opened Heim Regenerative Medicine in September 2009 with the vision of creating an alternative to the typical primary care office found in Western medicine, which is basically an hour-long waiting and 10-minute visits. His goal is to provide a comprehensive approach to your medical care. And it's an absolute pleasure, Dr. Mike, to have you on today. Thank you.
Thank you so much for having me, Ali. Good to speak with you again.
Yeah, look, it was absolutely eye-opening to meet you. And I remember we were sitting down having a conversation about stem cell therapy. And what really resonated with me was I sort of got your thoughts on it, and sort of to summarize, I guess you were like, yep, it's great. And I'm like, oh, so do you do it? And you're like, no. And I'm like, well, you think so highly of it. Why wouldn't you do it? And it then dawned on me, the problem that we have is that it seemed like that you didn't actually have anyone nearby that you would actually want to get stem cell therapy from. And that sort of alarm, it was quite alarming for me. So, I was a bit, I was a bit concerned after that. So that's why I've got you on today. And I guess, firstly, maybe if you could just tell us a bit more. I understand that regenerative medicine is a spectrum of different treatments. Can you explain like the different ones that you do?
Sure. Yeah. So I think it's a very important point to talk about, the regenerative medicine, or, it was once referred to as anti-aging medicine and still is in some realms. It is a big spectrum, and that covers everything from basics to nutrition and sleep and exercise, to balancing hormones, to aesthetic treatments, to more advanced treatments like biological allografts and stem cells and platelet-rich plasma. So orthopedic type treatments. I think if you're looking in this realm, it's a little like the Wild West right now. There's clinics that have popped up all over the country, and they're advertising miracle cures for everything from cancer to degenerative discs and MS, and stem cells are thrown around as a topic that is a cure-all. And you have to be very weary of those types of clinics. The basics are always going to be first. You can teach just about anybody to stick some sort of solution into a knee joint, for instance. But if that patient is not set up to recover well and is immunocompromised and follows a very poor diet and doesn't sleep and smokes, then that person isn't going to have much of an effect. So a true regenerative clinic should be really looking at all of those, taking a global approach to your health. With our patients, we start by spending an hour with them, and we go through their diet and their sleep history and their stress and their exercise routines, their injury history. And we want to get them prepared before we do any kind of procedure. So many times we're treating a patient for a month or so before we even do any injections or treatments.
Wow, that does sound unique, because most people just want to get you in, do some stem cell therapy, and get you out.
That's exactly right, and that's the downside of a lot of these types of treatments. If there's money involved, there's always going to be bad players. People that aren't experienced or don't have enough experience are jumping on the bandwagon and trying to make a buck for the short term. But that's not really medicine. And if you're practicing medicine, you should be addressing as many things as you can to help that patient recover and improve structure and function and health.
Okay, and so your expertise are definitely in the musculoskeletal side of things. So what therapies, obviously you go through, like you said, a year's worth of diet and lifestyle and all the important things. And then from there, what type of therapies do you use?
Yeah, so once we get that patient, what we would say optimized and feel like they're going to have a good response, the regenerative injections is also a spectrum. So prolotherapy has been around for 40 or 50 years, and that's an art of injection where you are injecting the tendons and ligaments and structural components of a joint, for instance, that stabilize that joint. We believe a lot of pain comes from instability in ligaments and tendons. And prolotherapy has been shown to strengthen structure over time. The solutions we use for those are sugar water and salt water and some sort of anesthetic like Procaine or lidocaine. Those are very effective, and I still use those as much as anything else. Again, a lot of these clinics, they only will give you stem cells when you could use something like prolotherapy, which is a 50th of the cost. So that's kind of the first level of the pyramid, so to speak, in regenerative injections. The next step up would be something like PRP or platelet-rich plasma. And that is a product that we get from the patient's blood. We draw their blood, we spin it in a centrifuge, separate out the platelets, and inject those platelets back in. It's the same injection technique. We're injecting at the base of ligaments and tendons around joints, and we get a more robust response from PRP than you would from a simple prolotherapy solution. And I probably do more PRP than anything else. And again, it's probably an eighth of the cost of something like a stem cell product, and sometimes works just as well. The peak of that pyramid would be some sort of stem cell product or biological allograft is how we refer to them. And those come from different sites. People use stem cells derived from body fat or bone marrow. There's also placental tissue derived or cord derived stem cell treatments. They probably do give you a little more benefit than something like prolotherapy or just PRP. A lot of times we can combine treatments because you're turning on different pathways depending on what solution you're using. But the injections themselves they're all the same in terms of the treatments that we use. And that's another thing I would stress that you really need to look at if you're looking at a clinic to have some sort of procedure done. You want to make sure they're trained in prolotherapy and not just sticking a solution in a joint, because you're really not going to get optimal results for repair and regeneration of a joint if you're just doing one injection into the joint space.
Okay, so just to backtrack slightly before we get into stem cell therapy, prolotherapy, what exactly is it and why would you use it given that PRP is more effective?
Well, so a lot of it has to do with how well you think a patient's going to respond and how much damage there really is. Before there was PRP and before there were stem cell treatments, there was prolotherapy for 30 years, and that's all we did in that realm. So the theory behind prolotherapy is twofold. So a lot of that research, the original research, came out of injuries like golfer's elbow, for instance. So you have an injury to a ligament of the elbow, and those tissues tend to not get a lot of blood flow, so they don't heal very well. A lot of times the body sort of forgets about those injuries and they just kind of stay chronically inflamed. And anybody that's had that injury knows it can last a year or more if you don't get something done with it. So if I take a needle and stick it in there and rough up the ligament a little bit, we call that dry needling. That's been around for thousands of years. Just doing that is going to give you an immune response. It sort of wakes up the immune system and says, hey, we need to come in and heal this injury. It almost tricks the body into thinking you have a new injury. On top of that, if you inject some sort of agent that amplifies the inflammatory pathways like sugar water or salt water, you get a much more robust response. And a lot of times I find that that's enough. Again, if it's more of an acute injury that's not really severe, like a tendonitis, prolotherapy a lot of times is enough, and you can save a lot of money by doing those treatments. If prolotherapy doesn't work, or you have more of a severe injury, then you want to go up to the next step, like something like PRP. So it really depends on what the patient is going through at the time and how much you think they need. If someone comes to me with a very severe arthritic knee that probably needs a replacement, but wants to put it off for a couple of years, then we probably go more to the top of the pyramid and use some sort of biologic allograft or PRP.
And you wouldn't use stem cell therapy in that case?
Well, yeah. So a biological allograft has mesenchymal stem cells. The terms are being thrown around now in different ways. So when you say stem cells, that's what I'm referring to as a biological allograft.
That's just the technical words for it. I didn't realize.
Yep.
Okay, so on that note, then I'm a bit confused as a consumer as to what the benefits are of stem cells in terms of, a lot of people are talking about how it helps with anti-aging. So I know that you're more sort of, I guess you help people with that as well. What are your thoughts around the benefits of stem cell therapy for anti-aging and what do the studies show?
So, there's two sides of the story there. One is the orthopedic side. There's a lot of good studies out on the orthopedic side as far as regenerating tissue and repairing tissue. We know that's the job of stem cells. So from a regenerative standpoint, we can really slow down aging and reverse some of the damage that we've done over the course of our lives with injuries and athletics and things like that. The anti-aging side is kind of in its infancy. I think that stem cell products will change medicine forever eventually. I just don't think we have enough of a handle on it yet. Again, we're in the Wild West right now. We're doing intravenous stem cells. We're doing intrathecal stem cells into the spinal canal. They're just about putting them everywhere. And anecdotally, we're seeing some really good results. There's probably not enough long-term studies yet to make definitive statements on any of it, but I will tell you anecdotally, we are seeing things reverse like macular degeneration, diabetes. There seems to be a good response with chronic lung disease. So there is some magic in these treatments. They are not cure-alls and they are not miracles, but and I think once we really harness that power, again, it's going to change medicine forever. It will probably make a lot of current treatments obsolete. We're just not quite there yet. We're doing a lot of tinkering. If the government would get out of the way, we'd probably be able to do a lot more. But in this country, we're harnessed a little bit there.
Yeah. So how exactly are you harnessed by the government?
Well, one of the big things we cannot do in this country is reproduce stem cells. So in other countries, you can harvest stem cells from a patient from their body fat or their bone marrow, or you can use placental-derived or cord tissue-derived stem cells, and you can put them in a petri dish and grow them. And you basically have an unlimited supply of those. You're not allowed to do that in this country, and that holds us back. From a supply standpoint, we really have an unlimited supply of placental-derived tissue that is left over after a woman has a healthy baby. You have the placenta that is typically medical waste. It's thrown away, but it's a very rich source of growth factors and anti-inflammatory factors and mesenchymal stem cells. But the harvesting of those cells and those products is time consuming and it's very expensive. Whereas if we could take one placenta and harvest stem cells from it and then reproduce them over and over, it would be a lot more cost effective.
Right. Okay. And so what about embryo stem cell therapy? I'm assuming that that's not an option in the US.
No, that's illegal here, and there's a lot of ethical issues there. So embryonic stem cells are from an embryo that's a fertilized egg, or fetal stem cells would come from fetal tissue. So the moral issues there are evident. They are what we call pluripotent stem cells, which means they can really turn into just about anything: skin, hair, nails, cartilage, ligament, bone. But there's a deep divide in the moral side of harvesting something like fetal tissue. Whether a fetus dies before birth, or not, it's a big bone of contention, obviously, and I think for good reason. The extreme side of that would be growing embryos and fetuses in a test tube for the sole purpose of harvesting stem cells, and that in my opinion should never be done, because you're creating life and then destroying life. Placental-derived, on the other hand, is something that, again, is the placenta is typically medical waste and it's thrown away. So there's an unlimited supply, and you can get mesenchymal stem cells from there. So mesenchymal stem cells are a little bit different than embryonic or fetal in that they seem to be a little bit more limited in what they can turn into. They have a huge potential to turn into musculoskeletal tissue, cartilage, bone, ligament. And that's primarily what they're used for now. So that gives you a little bit of information on the different types.
Yeah. So in your clinic, then, what types do you use, and what have you found to be the most effective?
So I've chosen to use placental-derived allografts. They're from the cord of the placenta. They're from the actual tissue. A while back, we were all using cord blood, so the blood inside the cord. We now know that that's a pretty poor source of mesenchymal stem cells. They're still used in some areas, because there's all kinds of other growth factors and anti-inflammatory effects of cord blood-derived tissue. But every year we get a little better at harvesting and dialing in what the best products are. And right now, personally, I believe the placental-derived tissue is the best thing going. There's lots of opinions on that. Some people will tell you should take it from the body fat of the patient. Some people will tell you should take it from the bone marrow from the patient. There's different problems with those. One of which is they're minor surgical procedures you're doing on a patient. So it's one more thing that you can have complications from. Basically, you're doing a liposuction procedure, which is not a benign procedure, or you're doing a bone marrow tap where you're drilling into a bone to get bone marrow out and then processing stem cells. So one of the theories behind using placental-derived tissue cells is that they are brand new, they're young, and they're much more potent than I can pull out of, say, a 50 or 60-year-old adult. So I've chosen to go that way, and we have great results with the treatments that we do. I don't advertise myself as a stem cell clinic. We're a regenerative medicine clinic, and we use appropriate treatments depending on the patient. So again, we use that stair-step approach, and depending on what the patient needs, that's what we're going to do for them.
Yeah, I love your approach, and interesting the difference there that you give, and the reason why you sort of use that approach to the placental as opposed to the bone marrow or the fat, which is a bit of a contention amongst the field at the moment, and especially you mentioned the ethics behind embryonic stem cell therapy, and that's also an interesting one, and I guess probably won't become legal in the States. But I guess ignoring sort of all of that, in terms of I guess efficacy, we probably won't know for a while. I mean, there are a lot of sort of trials underway at the moment, but like anything, it'll take a long time to really see the benefits. What are your thoughts in terms of just giving it a go? Like, for example, if you presumably being a doctor, you do have access. If you actually had someone that you trusted to inject those stem cells, would you do it on a regular basis?
You're talking about mesenchymal stem cells?
Yeah,
we're not talking about fetal stem
no,
cells.
Absolutely, yeah.
So just to correct you, I have had these procedures many times. After 30 years of racing, my body is pretty broken. So I've actually had PRP and prolotherapy and stem cell products injected into my neck, my back, both of my knees, a shoulder, and both of my elbows. I just haven't had them done locally. I typically have them done at conferences that I attend where they're teaching these procedures, where we can kind of work on each other as physicians. I just haven't found that person locally that I'm willing to let stick a needle in my neck just yet. So yes, I have my knees done a couple times a year, and I actually do those myself. The other areas of my body, I have to wait until I go to a conference and find someone that I trust to inject.
But on the anti-aging front, assuming that there's no bad side effects.
Mm-hmm. Yeah, I think it's going to change medicine forever. I would have no qualms trying an intravenous treatment. We're still trying to harness that, and there's different ways that they're being administered. But I know anecdotally we are seeing reversal of disease in many areas. There's over 600 studies alone going on right now in autoimmune disease with intravenous stem cell products. So I would have no problem doing treatments.
And are there any bad side effects at all?
We haven't seen any in the musculoskeletal side. There's always a risk of rejection of any tissue that's not coming from your own body. But these products are sterile and they are considered immune innocent, meaning they don't have the markers or antigens that cause the body to reject them. So, you might see someone have a little flu-like symptoms for a day or so, but generally very safe. They've been using bone marrow transplants, which are considered stem cell transplants, for 30 or 40 years. They're FDA-approved treatments for different conditions, and we use them in children in particular. So they're very safe. From an orthopedic perspective, you always want to make sure you're doing everything as sterile as possible. Our biggest risk is sticking a needle through the skin because you can always cause an infection. But over and above that, the products that we're injecting are the same products that help us fight infection and reduce inflammation. So your chances of any kind of side effects are very, very low.
Great. So if our listeners have potentially tried PRP and it hasn't worked, and they would like to try stem cell therapy and they don't unfortunately live in Tampa or Florida or nearby you, how would they go about finding a doctor that I guess was safe?
Yeah. Well, you definitely want to do your due diligence. I always recommend, I offer a free consult for any patient that wants to learn about what I do, whether it's hormone treatments or nutrition treatments or orthopedic treatments. I want to be able to sit down with the patient and make sure they fully understand what they're getting into, and they are comfortable with me as a physician. I do a lot of consults and a lot of people don't come back because I start talking about the procedures that I do, and it probably scares them a little bit, but that's a good thing. I want them to make sure they're absolutely clear on what is about to happen. So in terms of finding the right physician, I've done a lot of my training through an organization called the AAOM, the American Association of Orthopedic Medicine. They are one of the best and biggest educational programs as far as prolotherapy, the art of these injections. On their website, they have a list of physicians that have been trained through them, and I think that's a great place to start. Again, I would sit down with these physicians, but you really want to make sure they're well versed in regenerative medicine and they're not just selling you an injection. If you're going in for a knee injection, the question you ask that doctor is this just one injection in my joint? And if they say yes, then that's not the right physician. They're not addressing the whole joint, the structure and the integrity of that joint. I would also make sure they are addressing other areas of your health. If they're not looking at your diet and your hormone status and your sleep status, medications that you might be on, all of those play a role on the immune response your body is able to make. And if you're a poor candidate for these treatments, then it's going to be a waste of money for you.
Yeah, and just to backtrack there, Dr. Mike, what do you mean there by just looking at going in on the one joint?
So I always use the knee as a good example. So I probably do more low backs than anything, lumbar spine, but knees are probably a close second. So, traditionally people get knee injections with a steroid, for instance. That's traditional Western medicine. It's an anti-inflammatory. It calms things down, gives people temporary benefit. It doesn't fix anything, but it might reduce pain for a month or 6 months or even a year. There's nothing wrong with that. I personally don't use steroids because we now know that steroids are also chondrotoxic. They are toxic to the cartilage. So over time, they can actually degrade cartilage further. So if someone doesn't have a severe arthritic knee, a lot of times they might have a small tear in a meniscus, for instance, or they just have pain and they're not really a surgical candidate. A lot of the theories in what I do are that pain is caused from instability in the joint. So that knee joint is moving around too much. And the reason it's moving around too much is because the ligaments and tendons that hold that joint together have become too lax. And that could be from injury. I was a hurdler, for instance, in my younger years, and that puts a lot of strain on the trail leg knee. So I probably stretched out one side more than the other. So over time, that causes instability. And every time I walk or run, that instability causes that knee to move around too much. So if I have someone that comes in with an injury, a small meniscus tear or a little bit of arthritis, I can stick some sort of product into the knee, and they're probably going to have some benefit. Again, there's some anti-inflammatory properties, there's some growth factors in these products, and there are mesenchymal stem cells in those products. But it doesn't address the problem, which is the instability in the knee. So typically I'm going to do a thorough exam on that knee and see where they're loose and see where their pain is. My patients will tell you I'm very good at finding pain they didn't know they had until I started poking at them. So you have a lateral collateral ligament and a medial collateral ligament. You have a joint capsule. You have the patellar tendon, quadriceps tendon, PCL, ACL. You have all these structures that hold that knee together and keep it from moving too much. You really have to address all of those areas and inject all of those areas that might be adding to that instability, because over time with these treatments, they will actually tighten that joint back up and make it stronger.
Got it. So presumably then just going into the one joint's not going to solve the problem.
It's not, no.
And so interestingly, you mentioned there the instability and that this is essentially a Band-Aid unless you address the real issue. Do you then sort of refer them on to a physiotherapist or give them exercises to do?
Absolutely. A lot of these patients are athletes. They may have been injured for a long time, so they start to have imbalances. And there's all that stuff we talked about leading up to a procedure, fixing their nutrition and their hormones and whatever else, sleep and stress. And then there's what happens after the injections. And you certainly want to make sure the muscles are strong around those joints. They're getting blood flow. So just exercise in general is going to help with healing. We need good blood flow. We need flexibility. We need to continue to address the things that help us function optimally. So we use physical therapy. We use manipulation in some patients. Whatever it takes to get them back to full function or close to it.
Okay, so assuming that our listeners go to a doctor that addresses all the joints, and after the therapy, and assuming also that the client does the PT necessary, how long would it take for sort of the benefits to kick in and to know whether it's worked? And then after that, how often would they need to go back and get another injection?
So that's a great question. Some of that depends on the products that you're using, generally speaking. So if you remember the spectrum from prolotherapy to platelet-rich plasma to allografts, the further down the spectrum you go, typically the more treatments that you need. So with prolotherapy, we tend to tell patients you might need 4 to 6 to even 10 sessions over the course of, say, every 4 to 6 weeks having another session. With PRP, it tends to be less, maybe 1, maybe 3, maybe 4. With the allograft, sometimes you're one and done. A lot of the protocols now are to do something like a stem cell product on day 1, and then on day 14 or 30 or 60, you do a PRP, and then you do another PRP 30 to 60 days down the road. Your full effect from one session is 6 months. So what that tells you is, I'm going to inject you today. If I'm injecting your knee, I'm going to give you a bunch of injections. You're going to be worse for a couple days because we're ramping up all of these inflammatory pathways and healing pathways, and then it calms down. And then you have a couple weeks of what we call remodeling. The body is bringing in growth factors and collagen and laying down that new collagen, and then that new collagen has to dry up and tighten up. That process takes about 6 months. So you definitely have to be patient with these treatments. A lot of people will call me back after 2 weeks and say, hey, I'm no better. And I tell them, okay, call me back in 4 weeks, and we'll talk. I see a pattern with PRP in particular. People that have moderate injuries, I'll do a session on them and they'll come back. I tell them to come back in 4 weeks and we reassess. If you're 20% better in 4 weeks, then we're definitely going to need another treatment. A lot of times I'll see 20% improvement in the first treatment, but then we'll get up to 50% after the second treatment, and then maybe even more than that after the third. So a lot of times I'll do a treatment today, I'll do a treatment in 30 days, and I'll do a treatment in 60 days, and then your full effect is 6 months from that last treatment. So, in our culture, we want to be better right now. We want a pill that fixes us right now. And that's not how the body works. We are trying to turn on the body's immune system to heal itself. And that happens on its own time frame. And there's not a lot you can do to speed it up.
Yeah, it's a very true and interesting point that you mentioned about the now. As soon as you say, oh, this could take 6 months, you might lose a few clients there as well. But also, I guess another thing that our clients, like our listeners, should be aware of too is the pricing, because I see an absolutely astronomical difference between some of the pricing, especially when it comes to stem cell therapy, and even overseas. It just seems like it's a bit of a money-making business. What are your thoughts around the pricing?
Yeah, I mean, I'm probably not the best business person in the world. I try to make my treatments available to as many people as I can. I mean, I am a businessman and I'm in business to make money, but what I see out there is people getting raped by these clinics. I see people charging, $15,000, $20,000 for a procedure that might cost $3,000 in my clinic. I don't have anything against capitalism. I'm a hardcore capitalist at heart, but I think there's a line that you go over at some point. And you're not really practicing medicine at that point. You're just making money. There's a huge disparity. Some of it is the area of the country that you're in. On the west coast of Florida, for instance, it tends to be cheaper than the east coast of Florida, certainly the southeast coast down in the Miami area. But it's kind of what the market will bear. If you open up a clinic and people are willing to pay a lot of money for treatments, then, more power to those people. I think a lot of times there's not enough research done though to find the same product for much less price.
And I guess too, if the government comes to the party and makes it more sort of efficient for doctors to be able to grow their own cells, then we might be able to get the prices down.
Yeah, that'll be a game changer. Right now there's a sort of a moratorium from the FDA who regulates these products. November of 2020 is kind of the drop dead date for when they're supposed to make a decision on how these treatments should be done. It's a little scary what you're seeing out there with some of the verbiage, but they're doing their due diligence, which is good, as opposed to just shutting it down completely. The problem is you have these clinics that are really just, again, the Wild West. They're injecting all kinds of areas they probably shouldn't be, that they don't know enough about, and they're having bad outcomes. And that's kind of spoiling it for the rest of us.
One last question regarding stem cells. I've got one of my listeners actually asked me a question about embryonic stem cells, which incidentally is $16,000 overseas at this particular place, and has the option to actually partake in it for free. If that was your option, what would you do?
Embryonic stem cells, I'm not using. Again, I just have a moral problem with creating. You're essentially creating life and then destroying that life. That's my personal view on it. And the other half of that is, I'm not sure. I mean, depending on what you're treating, I guess, I'm not sure you're getting some kind of huge improvement in effect. The products we're using now are very effective. Again, not miracle cures, but we're seeing really good results. So unless you can show me a study that definitively shows that an embryonic stem cell is in another stratosphere in terms of effect, then I just don't know why you would go that route.
But I feel like, Dr. Mike, even if it was a different type, you'd still say no, because you don't know the practitioner and you're not sort of confident unless you did a lot of research on that particular person that was injecting.
Oh, no doubt. Yeah. You want to be very comfortable with what you're getting into. You want to be well informed, and do your research, even to the point of questioning where your products come from. There's certain companies I use for products because I trust them and I know their process, and they've done a lot to advocate for the industry. But you've got a lot of fly-by-night companies that will close down after a year or two, and you know those are the ones to avoid.
Yeah, absolutely. Look, Dr. Mike, thank you so much for all this information. It's really valuable, and I know a lot of our listeners really need to know about this. So thank you so much.
Thank you so much for having me, Ellie. It was great to talk to you again. I hope to talk to you again soon.
And Dr. Mike, just before you go, just a quick question. Do you have a tattoo?
I do have a tattoo. I have a single tattoo on my left leg that I got after doing the Ironman. So it's sort of tradition. I trained with a group of people for many months to finish my first Ironman, and then afterwards, a couple of us went and got our tattoos. Wow,
I didn't notice that. I would have teased you if I had have seen that. Excellent. Look, thank you so much. And obviously, I'll put everything in the show notes so that you can get in touch with Dr. Mike and hopefully go and see him at his practice. For all the resources and show notes from today's episode, please go to www.ali.fitness. If you liked today's episode, please show your appreciation by going to iTunes, give us a 5-star review and subscribe.